Hey all, Dr. Jerome Edelstein here. I'm going to talk to you about the three most important decisions you need to make when you're considering breast implants. First decision is what type of implant to use. And there's two main categories. There's salines and silicone cohesive gels. Both of these implants have outer shells that are made of silicone. The salines contain salt water. It's basically water. The silicone cohesive gels have a silicone gel that has the consistency of a gummy bear or jello. Nowadays, I tend to use the silicone cohesive gels much more. I find that if I take proper measurements and size your body properly, I can actually make both implants look good. The reason that I lean towards the silicone cohesive gel is the feel. Okay, they feel much more like a natural breast. For sure, though, if somebody comes in and for personal reasons they want saline implants, I'm okay with that too. The second option is where to put the implant. Do you put the implant over or under the chest muscle? Putting the implant over the muscle so that it's sitting right under the breast is called subglandular placement. I tend to use that more in patients that have some degree of droopiness because I find that you get better lift when the implant is sitting right under the breast as opposed to under the muscle. I also use it in patients that have a lot of breast tissue to begin with because they're going to be able to camouflage the implant fine. There's no need to go under the muscle. The subpectoral or under muscle placement, also called submuscular, that I commonly use in patients that don't have a lot of droopiness and are relatively on the thin side because the muscle is very good at camouflaging the implant, making it less seeable and feelable. I use both over and under the muscle placement quite regularly. The third option is incision placement. There's three options here. You can place an incision under the breast in the fold. You can place it partway around the nipple called periareolar, or you can place it in the armpit, which is called transaxillary. The incision under the breast is called inframammary. I tend to use the inframammary incision most often. I find that the incision invariably heals quite well. It's a very fine line. The breasts relax after the surgery. The incision is tucked up underneath. You don't see it when you take your clothes off. You actually have to like lift the breast, and look. And I also find that the incision is usually placed just a few millimeters above the fold, almost on the underside of the breast. And that's helpful when you're wearing a bikini and you go and you lie down on a lounge. The bikini top always rides up a little bit, and the incision won't be seen. The main reason, though, that I use the inframammary incision, the incision under the breast, is in my hands it has the lowest complication rate. For sure, just like over or under placement or saline implants, if somebody prefers a nipple incision or an armpit incision, I'm happy to do that as well.